Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
The vascular dementia. Vascular dementia is the dementia which is associated with cerebrovascular disease. So, this vascular dementia is of two types. One, we have multi-infarct dementia, which is also called as diffuse white matter disease, or which is also called as subcortical arteriosclerotic encephalopathy, which is also called as Binswager's disease. So all these are the names of this um vascular dementia. This is first type, which is multi-infarct dementia. The second type is actually the amyloid angiopathy. Amyloid angiopathy of aging. Here in amyloid angiopathy of aging, there occurs, here as the name says, it mainly occurs on aging. On aging, there is accumulation of amyloid, which is a substance which is accumulated in the cerebral blood vessels. So amyloid is a proteinaceous substance which is accumulated in the cerebral blood vessels, which will result in amyloid angiopathy of aging. This amyloid accumulation will predispose the person, or it will increase the risk of hemorrhagic stroke in the person. Then, even this amyloid angiopathy is also seen in patients with Alzheimer's disease. In patients with Alzheimer's disease, will also develop this amyloid angiopathy. Okay, because they develop amyloid angiopathy in the Alzheimer's disease increases the risk of cerebral anomalies, cerebral issues, or cerebral memories, all that is increased because of the amyloid angiopathy.
thank you and thank you for watching.